Cast is the common term for a dental imprint in a flexible cast material. The dental imprint is like a negative of your mouth. Plaster is then poured into this imprint in order to acquire a copy of your mouth, a model, which is true to the original. A prosthesis is then fashioned based on this plaster model, so the quality of this prosthesis, the tightness around the edge, the precision of the fit, and the height thus depend on the quality of the imprint. Imprints should always be taken with whole scoops, shown here on the left. Partial scoops, shown on the right, are usually imprecise, since the plaster imprints cannot be positioned correctly relative to each other. With a partial scoop, a technician only gets partial models, which can be rotated in relation to each other, thus making it difficult to find one definite position. The prosthesis, shown here in blue, cannot be precisely modeled. A whole imprint provides whole jaw models and thus a three-point contact. The models are fixed, thus allowing a technician to make a prosthesis with an exact fit. To get precise edges, the cast material must be able to flow freely around the edges of the teeth, without the gums, blood, or saliva surrounding the tooth. Any bleeding must be stopped and the gums pushed aside, for example with thread. Only then can the technician get precise edges. A pre-imprint, the cast material shown here in pink, prevents the teeth from touching the scoop, known as extrusion. If the metallic scoop can be seen through the imprint, then the imprint must be repeated due to extrusion. The arrows in the picture point to the extruded places. In extrusion, the tooth is pulled back a little, which results in a faulty cast, for which the technician inevitably fashions a badly fitting prosthesis, resulting in long running in and untight crown edges. Once the preparations have been completed, the actual imprint is taken. A fine needle is used to position the cast material in difficult spots and distribute it evenly using the air blower. The custom-made scoop with the cast material is then placed in the mouth. The cast should definitely be kept in the patient's mouth as long as the manufacturer's instructions specify. A dentist who works accurately always uses a stopwatch. The cast is then removed, examined under a magnifying glass, carefully packed, and sent to the technician, who then fills the cast with plaster after a certain amount of time. If these times are not observed, the imprint gets warped. One more reason for a faulty prosthesis.